Hey guys, are you dealing with a knee problem that just isn't getting better? Perhaps you've been to an orthopedist and had it checked out and maybe even gotten a diagnosis on it, or maybe they didn't find anything wrong with it. Perhaps you've been through PT, which maybe helped some, but it's still giving you trouble. Or maybe it hasn't hindered you enough to have it checked out, but you know that something's just not right and you should have it looked at. In this video, we're going to talk about chiropractic's unique approach to knee problems and why it might be the missing link in helping you with your knee issue. Now, I am personally no stranger to knee problems. In high school, I skateboarded on the big vert ramps, the big half pipes, and completely tore my PCL in one of my knees, which is the posterior cruciate ligament. And 6 months later, I completely tore the PCL in my other knee. When I got into my 20s, I started into running. And when I did so, I started getting pain on the outside of one of my knees. I thought it was IT band syndrome, which is common in runners, but I mentioned it to the chiropractor who was taking care of me at the time, and he took a look at it. He found a misalignment in the knee, adjusted it with a specific technique I was not familiar with at the time, and it completely cleared up my knee pain. So I was like, I need to learn that. So I went to seminars and got trained on how to assess the knee using that specific technique in other extremities, using that protocol, which is called the Schret adjusting protocol. I will show you how I assess the knee using this protocol a little later in this video. As you probably have now guessed, the missing link in a knee that is not getting better is that it could be misaligned or subluxated, so it's not functioning properly. As I covered in my previous video on extremities, a joint that is misaligned or subluxated cannot function normally. So how do you know if your knee is out of alignment? Have it checked. To understand this better, let's take a look at the knee model. The knee joint is what connects and allows motion between the femur, the upper bone in your leg, and the tibia, the main lower weight-bearing bone in your leg. The cushion between these bones is the meniscus, these blue pads on the model. And just for reference, the other bones you see in the model are the kneecap or patella and the fibula, which is the smaller non-weight-bearing bone in the lower leg. The ligaments and tendons that you see are the quadriceps tendon, the patellar tendon, the lateral collateral ligament, the medial collateral ligament, the anterior cruciate ligament, which is the ACL, and the posterior cruciate ligament, which is the PCL. The knee is a hinge joint, which allows you to bend your leg. When flexed, the knee allows for rotation of your lower leg. When extended, the knee locks and is extremely stable. It is this characteristic of the knee that I use to check for misalignment or subluxation. Now, one of the most common knee misalignments that I find is the posterior tibia. This is where the tibia misaligns posterior to the femur. As I mentioned, when the knee is in extension, it is extremely stable. However, when the tibia slips back or posterior in relation to the femur, the knee joint loses that stability. To check for this, I have a patient straighten their leg and lock out their knee. I will then push the knee side to side looking for any motion. If it is in alignment, there will be no motion in the knee. However, if I'm able to move the knee from side to side, this indicates misalignment. In the case of the posterior tibia, I will then make an adjustment on each side of the tibia to move it forward and realign it with the femur. The adjustment does not hurt, and the cool thing is we are able to post-check it right after the adjustment to make sure that the tibia is now in alignment with the femur. Now, obviously, it will depend on the condition of the knee as to know how it responds to the adjustment, but many people notice a significant difference after the adjustment, saying it feels like it's more oiled. But no matter what is going on with the knee, it will function better if it is in proper alignment. Now, if you have had a knee injury and suspect there's a ligament or meniscus damage, definitely have it checked by an orthopedist. But as I mentioned at the beginning of this video, if you've done that and there's no major damage to the ligaments or meniscus that would require repair, definitely have it checked for misalignment or subluxation. If you're doing PT for your knee, great. It's super important to strengthen the muscles around the knee to help with stability and function. But it will work even better when it is in alignment, so make sure that you get it checked by a chiropractor. So if you are dealing with a knee issue and you have not yet had it checked by a chiropractor, I encourage you to do so. And if you found this video helpful, I also encourage you to like it and share it with someone else you know who may be dealing with a knee problem and could be helped. And I invite you to subscribe to this channel so you can find out more about how chiropractic can help you and the ones you love. Thank you so much for watching this video, and I'll see you next time.